Rheumatoid arthritis. In rheumatoid arthritis, rheumatoid refers to rheumatism, which is painful diseases of joint. Arthro refers to joint, while it refers to inflammation. Rheumatoid arthritis is a chronic autoimmune disease that causes inflammation around the body and commonly presents with pain in the joints. Rheumatoid arthritis is an autoimmune disease that is triggered by the genetics and environment factors. For the genetics, it is associated with specific HLA loci involving HLA-DR4 and HLA-DW4. A part of that, exposed to cigarette smoke and pathogens. This environment factors can cause modification of our own antigens.
Rheumatoid arthritis is an autoimmune disorder. This means the body attacks itself by mistake. In rheumatoid arthritis, the immune system attacks joint and organ tissues. Here's how it happens. The white blood cells of the immune system move into the joint. They release chemicals called cytokines, which attack the cells of the synovial membrane. These chemicals cause synovial cells to release other destructive substances. They also cause the synovial membrane to grow new blood vessels and form a thickened area called a pannus. Over time, as the pannus grows, it invades and destroys areas of cartilage and bone inside the joint. Inflammation causes fluid buildup in the joint, making the joint swell. Eventually, without treatment, the joint space narrows and ankylosis can occur. Ankylosis is fusion or growing together of bones in the joint.
Rheumatoid arthritis can affect multiple joints, and usually more than 5 joints are involved and symmetrical. This means that both sides of the body can be affected. It commonly affects small joints, for example, metacarpophalangeal joint, MCP, proximal interphalangeal joint, and metatarsophalangeal joint. As the disease worsens, it can affect large joints, for example, shoulder, elbows, knees, and ankles. Early signs and symptoms typically involved sudden worsening of the joints, including swelling, warm, redness, and painful on the affected site. The person also feels stiffness, especially in the morning. These subsequently make it hard to perform daily activities, for example, writing, holding objects with hands, walking or climbing stairs. Noted that people with rheumatoid arthritis often feel fatigue and general malaise, and may experience depressive symptoms since it can affect mood. Individuals with rheumatoid arthritis may experience different types of deformities, depending on the rate and manner in which their joints and ligaments deteriorate due to disease. The specific deformities include ulnar deviation. Chronic inflammation of the MCP joints damages the joint capsule and surrounding structures, which can result in ulnar drift. Next, boutonniere deformity. A boutonniere deformity can affect the index, middle, ring, and little fingers. The result is that the middle joint, PIP joint, of the injured finger will not straighten and remain flexed, while fingertip bends back, hyperextends. Lastly, the swan neck deformity. Swan neck deformity is characterized by hyperextension of proximal interphalangeal joint, PIP, and flexion of the distal interphalangeal joint, DIP. The diagnosis involved blood tests to detect rheumatoid factor. High levels of rheumatoid factor can make a diagnosis of RA. However, RF levels may also be high in other autoimmune diseases, so an RF test need to be conducted along with anti-CCP antibody test, ACCP or CCP. Diagnosis also involves imaging test, which is X-ray. X-ray detects soft tissue swelling, decreased bone density, narrowing joint space, bone erosions, and joint subluxations. Physiotherapy assessment includes assessment of posture that involves observing for joint deformities, spinal alignment, and balance issues. Next, testing muscle strength and power that often involves various tests like manual muscle testing, MMT, to evaluate the strength of specific muscle groups. Physiotherapists also do the gait analysis. This is because people with rheumatoid arthritis may exhibit changes in gait patterns due to joint pain, stiffness, or deformities. Then, physiotherapist will measure joint movement and do functional test. Now, we will move on to the goals of the management. The goals are to focus on relieving pain, prevent damage or disabilities, patient education, Physical therapy for stretching and ROM exercises. This also involves the role of the occupational therapy for splints and compression devices. Treatment also need to start early. The rheumatoid arthritis cannot be cured, so the medical treatment involve drugs and medications to relieve pain and inflammation. The drugs such as NSAIDs, steroids, DMARDs, immunosuppressants therapy, and biological therapy. However, the surgery will be done if the patient develops persistent pain, worsening of the joint function, progressive deformities, persistent localized synovitis, nerve entrapment, or deformities that become irreversible.
Physiotherapist plays a vital role in treating the patient. The physiotherapist treatment involves hot and cold therapy. Heat can relax muscles and help lubricate joints, while cold can reduce inflammation, swelling, and pain. Physiotherapist also will recommend transcutaneous electrical nerve stimulation, TENS. Next treatment is hydrotherapy. The warmth of the water allows your muscles to relax and eases the pain in your joints, helping you to exercise. Massage therapy is also beneficial for the treatment of rheumatoid arthritis.
Physical exercises are also recommended in treating rheumatoid arthritis, including pelvic tilt, side-lying leg lift in crossover, quadruped arm with leg raises, wall squat, the plank and diagonal curl. The exercise can be done in 5 to 10 times in 2 to 3 sets per day. Lastly, there are also exercises to improve hand and finger mobility. This include fists, claw stretch, make an O, finger walking, finger lifts, finger stretch, finger bends, pinch strengtheners, tennis ball squeeze, and thumb bend.